It's time for your C&P exam. This is your chance to present your case to the examiner and ensure they have a complete understanding of your knee condition. The examiner is going to ask questions like, tell me about your knee pain. When did it start? How does it affect your daily life and work? Be honest but thorough. Describe your limitations. I can't walk more than 100 feet without pain. I have to use stairs sideways or avoid them altogether. The knee gives out unexpectedly, so I'm afraid of falling. I can't kneel, squat, or sit for long. I am having trouble paying my bills because I have missed so much work due to my knee pain. When the examiners ask about your flare-up, let them know how they feel. When I have a flare-up, the pain shoots to an 8 out of 10 and I can barely move my leg. The tools used during the exam are a goniometer, which measures range of motion, flexion and extension in degrees. A tendon hammer checks reflexes, sometimes used. Stethoscope, if swelling is present. Their hands-on exam for crepitus, instability, and pain points. Make sure the examiner uses the goniometer. It is very vital to your appointment. When the examiner does the range of motions test, they will check for pain on motion, swelling, weakness, instability, crepitus. Knee conditions are usually rated under Diagnostic Codes 5256 through 5263. Conditions are limited flexion, 0%, 30%, limited extension, 0%, 50%, instability 0%, 30%, ankylosis 30%, 60%, meniscus, tear 10%, 20%, and total knee replacement 30%, min, 60%, 100%. Always be consistent with your medical records. The examiner may not look over all of your records, so talk about the flare-ups you have and how often you have them. I have to sit in the bottom row every time my family and I go to events because my knee swells when I climb too many stairs. When I sit for a long time, my knee stiffens so I can no longer drive when we have to go on vacation. When I was in the Army, I was injured during combat training. The pain has increased after all those years. Tell the examiner what job you had while on active duty. When they tell you to bend your knee as much as you can, to measure with the goniometer, when you feel the smallest amount of pain, stop right there and do not push yourself any further. That's as far as I can go. It's starting to hurt a bit. Even if the examiner gives you a frown and says, "Are you sure you cannot bend your knee any further?" Let the examiner know, "No disrespect, but this is my body." This exam is about you and what you go through on a daily basis. If you feel you have been treated unfairly or the examiner was inappropriate in any way, get the name of the examiner and report them to your local VA. Advocate for yourself because you are the patient. Good luck, you got this.